Ready? All right, so we have pain in the lower back that's been there for over 5 years. We did x-ray the hips and we can see a huge discrepancy within the hip bones. We can see this one is much higher and it's more out. This one is much lower and it's more in. And when we're checking the range of motion within the hip joints, there's no movement within the hip joint. So let's see that. Go ahead and stand up. And let's look at the range of motion. We can come over behind her, Lily. Go ahead and raise the right one. Levanta la pierna, este. You can see my thumb doesn't want to move. Put it down. The other one, that one doesn't want to move either. So both side joints are fixated. So we're going to see what happens when I open up the hip joint on the right. You can see this one is more out and it's higher. This one is more in and lower. So we're going to perform an adjustment where we bring this down and we take it in. So it'll be a PIIN on the right side. All right, so let's go over here on your side, face me. So de lado, por favor, mirándome. Again. This arm is here, this one is down here. We're gonna bend this leg.
Sí.
Yeah, she's got a lot of inflammation there. Este ajuste es muy fácil, no dolor. Wow, there's a lot of movement there. Muchos movimientos. All right, let's check it. Go ahead and stand over here. And we're gonna see how that hip's moving now on that right side. All right, so go ahead and bring this one up. So you can clearly see my thumb's going down. There's movement here. Perfect. The other one. And that one is still locked, but this one is moving way better. So let's see how we can improve this function. We're going to check that sacrum. Let's have you on your side, face me on this side. So same thing. And tell me if it's pain here. I'm going to touch different areas. So let's start with this one. Pain, pain, L5. How about here? Not too bad.
No.
And how about here? Not too bad.
No.
How about here? Not
No.
too bad. And here.
Ahí duele un poco más.
Here. So, más dolor aquí o ahí? Aquí.
Sí.
Okay. So we have pressure at the very bottom. This is S4. We'll be adjusting her S4 on the right side. It's excruciating pain. She does not like it when I touch that bone. So I'm going to keep my contact. Let's come a little bit closer to the edge. Right here. This arm is here. This one is here. And there we go. There you go. Nice and loose. Very good. It's a good movement. All right, let's check. So that was S4. Let's see if we got movement back to this hip. All right, so go ahead and bring this one up. My thumb's moving, the other one, that one is moving. Here again. All right, so we have movement. That was excellent. All right, so go ahead and sit back down. I'm gonna check that pressure with my scanner, see what we see. Okay, so the pressure that I had over here is no longer there. And that looks a lot better. Now there's a little pressure here in your mid-back. Do you feel the pressure here?
Sí.
So let's set that as well. We're gonna do that on the Gunsted knee chest, and that's T4. Let's take a look at that T4. So we have a listing of PRS on T4. Let's go ahead and set it. Come with me. So your knees are gonna be here, you're facing here. So T1, T2, T3, T4, PRS. So we're going to be on the right side of that spinous process. And nice and loose. We're going to give it a push right there.
Oh.
That was good. Okay, America. Back on the chair. You're doing great. Let's check that pressure, make sure it's clear. And we're gonna go on T4. That pressure is not there, so that's good. Let's check your upper thoracic and your lower neck. So this one is still there. We have a lot of pressure at T1. So I'll be setting T1 right there. Let's take a look. 1, 2, 3, 4, 5, 6, 7, T1. So because you have pressure in the base of the neck, you don't have the right curvature. So your neck is going more the opposite side and more straight. So I'll be adjusting the base of the head, base of the neck to open that up so that way your curve can come back. Go ahead and bring your head into extension. And let's do that again. Okay. Do you have pain on that level, which is T1 right here?
Mm-hmm.
She does. All right, so let's set that P2A. I think we're gonna get a good set if we do a P2A. So let's go here, America, face down. So boca abajo, por favor. And then put your hands on the floor. 5, 6, 7, T1. Bring your head up. Whoa. Muy profundo.
Mm-hmm.
Very deep. Back on the chair. Yeah. So she has been relaxed during the course of the adjustment. She's doing great. I think she's going to feel a huge difference. Let's bring this up from T1. And that pressure is a lot less on T1. Let's go again. And let's, I'm sorry, Lily, I'm on your way. Here we go. Seems to be some pressure there still, so I'm gonna go a little deeper on the chair. Sit back. More, and here. We're setting T1, PLS, relax the shoulder. Good, we got some more. That was awesome. Final check. Hopefully we don't have much in there. Okay, here we go. Nothing. All right, good. So now what we're gonna do is we're gonna leave the body alone so it can heal. So what's important is for you to always have that right posture. So, you know, when you're standing straight, right? So when you're sitting, same.
Okay.
You gotta sit up straight. So don't try to do this. Yes. So always shoulders are relaxed and you're just tilting your hips forward. So not like this, just here. That's perfect. So you want to be lined up, ear over the shoulder, over the hips, and I think you're gonna do just fine.
Oh, thank you.
How do you feel?
I'm feeling good.
All right.
Yeah.
So go ahead and move around.
Mm?
Do you
Parece
feel
que
any
no.
pressure in your hips or your low back right now?
No, parece que ya no me truena cuando camino. Yeah.
All right. So what we'll do is we'll do a follow-up in about 2 weeks to see how you're doing. Okay. But again, I don't plan on adjusting you too many times. We'll do a follow-up, see if you still have pain. If you still have pressure, we'll do some more. If you don't have pressure, we'll leave it alone.
Okay, thank you.
Okay. So just watch your posture though. That's most
Okay.
important.
Sí, está
Okay.
bien.
And your head is forward. So by adjusting this part, it's going to naturally come back.
Okay.
All right.
Thank you.
I think you're going to do just fine. You're welcome.
Thank you.